You feel nauseous, sick, and you feel like vomiting, and you don't know the reason why you're feeling this way. So I bring to you this series about what goes inside the mind of your doctor when he's trying to diagnose after you've mentioned a certain specific symptom. Now let's go through those questions one by one. Let's try to understand and decipher the mind of your doctor and to see what goes inside the mind of a doctor when he's trying to diagnose what is causing nausea, sickness, and vomiting. Now, vomiting can be associated with a lot of different causes, and they can essentially be divided into three basic types. The causes associated with the brain, which can cause a stimulation of certain centers in the brain, and subsequently the vomiting center or the sickness center, and then that causes the sickness to happen. The second cause could be associated with sensations or sensory organs, like the vestibular system, which is associated with the hearing system, or sometimes the visual stimuli, which can sometimes cause the vestibular system to be activated and subsequently the brain. And the third big cause could be associated with the gut or GI tract. Let's start with the first question, which is the duration of vomiting. Now, vomiting can be, or sickness for that matter, can be happening for only a few days. But it could be a feature of several days actually, which is called chronic vomiting or chronic sickness. If the vomiting has been happening for less than a week's time, then it could be associated with surgical causes, like a patient could have an obstruction of their outflow, food outflow, and subsequently they can start vomiting as a result of that. Another condition could be ischemic bowel, which is basically lack of blood supply to the bowel tissues can cause the bowel tissue to become dead, and subsequently the patient becomes really sick, really unwell, and they tend to have pain in their tummy as well. But it could be a feature of infection as well. For example, if someone has had a food from somewhere that they are usually not used to taking from, and then they can become sick as a result of food poisoning or infection for that matter. Sometimes neurological conditions, acute ones, can also cause vomiting and sickness. For example, if someone has got a space-occupying lesion in their brain, or nearby tissues, that could cause compression, severe headache, and as a result of that, vomiting can happen, or any other neurological condition, including infections, can sometimes cause someone to have sickness and vomiting. Now, I think the key thing to mention here is that all is not bad. If someone's been sick or vomiting for a short period of time, then probably it's more likely that this is more because of more benign causes rather than more sinister or bad causes, like the cancer I was talking about, or like the obstruction or bowel ischemia, or dead bowel for that matter. So it all sounds so scary, but probability is that someone is sick because of taking food from outside with food poisoning. So that's a more common scenario. So we usually, as doctors, when we are thinking about these causes, we always divide them into the most common and the most sinister causes. And the most common always comes first, but we always have to see the sinister causes as well, because we can't afford to, rule out the sinister causes without actually asking the right questions. So it's not always the bad case. So always just keep in mind that we're always going to ask these questions to make sure that the most sinister causes are also ruled out. So don't get panicked or scared when we ask these questions. Now, if you've answered that your vomiting has been happening for more than a month's time, then probably we're dealing with a chronic or long-term condition like a neurological underlying condition or a bowel motility disorder that you've had for some time. But it could also be a feature of an underlying disease condition, a bowel-related disease which has been going on for a longer period of time. But then again, sometimes in psychological conditions, the patient can have a long-term sickness or vomiting. So there are a lot of causes that come to our mind, and there are subsequent questions which I'm going to mention to you now, which will actually help us to make the final diagnosis. Now, another question that a doctor might ask is about the timing of vomiting or sickness. So they might ask, how soon after taking your food do you feel sick or you feel like vomiting? Now, if you answer that this is fairly quick, which is less than 1 hour, then probably it might be associated with the causes which are directly related to your gut or bowel for that matter. Gastroenteritis, or more importantly, food poisoning related vomiting or sickness is an example of that. But if you're mentioning that, or if you mention to your doctor that the vomiting usually starts after 1 hour or a bit longer than that, then it's usually called postprandial vomiting, which is usually associated with long-term bowel obstruction, partial bowel obstruction, or it could be associated with a condition called as gastroparesis, which is when your bowels, and more specifically your stomach, is unable to process the food or compress the food or churn the food as efficiently as it used to do before. And it's a feature which is pretty common in diabetic patients as well. So another important question that they might ask is about the contents of your vomitus. So they might ask, what is the color of the content, or what type of contents do you produce when you vomit? So if you answer that they're usually greenish colored, then what you're talking essentially about is that they usually contain bile in them. The bile is a chemical produced by your liver, essentially stored in gallbladder, and there is a connection between the gallbladder and your gut. So subsequently, this bile is used to digest your food item. So producing bile in your vomitus actually means that there is a patent connection after your stomach, so there is no obstruction probably, and bile can easily come back through the vomitus. But it's essentially one way of ruling out the obstruction side of things. But then again, the obstruction can happen down the way into the gut rather than up there just below the stomach. Now, if you've answered that the food items that you've produced are exactly as you ate them, so basically undigested food items rather than bile, then probably the vomiting is happening and basically the cause is up in your gut rather than down, and that also means that the food actually doesn't get enough time to get processed. And one of the common causes for this kind of vomiting can be a problem with your esophagus, which is the food pipe, which essentially allows the food to actually go down to the stomach, or the obstruction can happen just at the junction of the esophagus and your stomach, which can also cause the food item to be actually returned back even before they are digested down. Now, if you've answered that the vomitus is more feculent or it smells really bad, then probably you're talking about obstruction way down the line in the large bowel, and probably this is something that needs to be taken care of by a surgeon rather than a physician. Now, the next set of questions are usually related to the associated symptoms. So if you say that you've got fever, temperature, along with the vomiting and sickness, then we might be dealing with an infectious cause. If you do say that you've got headaches associated with vomiting, then we might be dealing with a cause which is related inside your head or brain, for that matter. Severe headaches sometimes can also cause sickness and vomiting in patients. Dizziness or having an ear infection can also be associated with sickness and vomiting. Now, once a cause has been identified, then subsequently a treatment can be suggested. Most common treatments include anti-sickness medications, which can be given specifically to target that acute phase when a patient is vomiting and not feeling well. But once that has been controlled, the key thing is to identify what's causing the vomiting or sickness and basically getting rid of that exact cause. There you go. So these are some of the most common causes associated with vomiting and sickness. And now you know the reasons why your doctor is asking all of those questions. If you like videos such as these and this specific series that I have started, then do subscribe to this channel, and also please press the bell icon so that you're the first person to know about these videos. I shall see you again with another one of these videos. Until then, take care of yourself and Allah Hafiz.